So since we began the HIP Cuyahoga process, we had community residents invited to attend our planning committee meetings and again participate in our quality of life survey. But the community conversations have really been our avenue that allow us, rather than us walking into a community and saying, here's what we think your issues are and here's what we think will fix your problems. We really sat down with them, allowed them to tell us what their issues were, and really listened to them on their suggestions and what they need to begin to change the landscape in their community. They're a powerful, motivated group, and it's been really invigorating for us to continue building our relationship with them and working with them to begin to improve the quality of life in our county.
For community engagement, one of the first things we did is when we put together our steering committee, we really wanted to make sure that we had as good a representation as possible of community members as well as community organizations and different groups in the community. It wasn't perfect. We were missing some groups for sure, and we've tried to incorporate them in the implementation process as we've gone along. However, we did have over 30 people participate. Each one of those people were community members who lived in different parts of the county. We made sure and get a wide variety of people that lived in some of the different smaller towns as well as the county seat of Ellensburg. Most of the people were represented in organization, but also were involved in other efforts, other volunteer efforts, maybe part of civic groups, other community groups, volunteer efforts in the community. So usually every person kind of represented a variety of groups in the community. And we also had several community members, community volunteers who helped with the efforts, who were, on different boards or participated in different efforts in the community on a volunteer basis. So we felt like we had a pretty good representation to start with to kind of guide the process and kind of give feedback along the process along the way. Throughout the process of doing the CHA and the CHIP, we also tried to incorporate other community members as there was opportunities to do so. We did a lot of the work within our steering committee, but we also took some of the work to other groups of folks. So for example, with the local public health system assessment, there were several questions in that assessment that have to do with the emergency preparedness in the community and the capacity that we have. So we actually went to our local emergency management council to get feedback on some of those questions. And that was kind of our way of incorporating more community, as well as some of the events we did for the community themes and strengths assessment.
Well, community engagement is a really important part of this process because if we're putting a plan together and we haven't heard from people, that really isn't netting us much. So we tapped into what we'd heard from the community prior to our planning process because that's valid community input as well. Then we had a steering committee that helped us think about who are the stakeholder groups that we want to involve and who had relationships with those stakeholder groups and how could we personally invite people to the table so they would be part of some of our community engagement process. And then as we've looked at creating action around our plan, we have invited, again, a broader group of folks than the steering committee or even the first community engagement group so that we keep widening our circle of involvement.
We were very fortunate to start with a number of long-standing, very strong relationships, about 20 in Cobb and about 10 in Douglas. We very deliberately used what we call our public health system egg diagram, which I think NACCHO folks are familiar with, and we took that and sort of customized it to each of our counties and used that to help recruit what we felt were key additional partners. Examples of partners that were involved were the Department of Public Health, of course, in Georgia, both of our county commissions, our community service boards in both counties, our very large Wellstar Health System, Kaiser Permanente, the Emory University Hospital System, and Healthcare Georgia Foundation.
We have definitely started engage the hospital in more conversations. It is interesting to see how this is evolving, where the hospitals come to the health department. And of course, we both provide healthcare, but from a different level, a different perspective. But it's actually been a very beneficial thing to see that the hospital is coming to us for that public health information and advice, and that they're now very much engaged in seeing the disparities and inequities in the community and working toward improving health.
How we've improved partnerships is by collaborating more on community events. We have went to a veteran stand down, which we really target and do screening for homeless veterans. We have begun to do community walks with different partners. Whatever somebody is doing that is centered around population health, we are more at the forefront in engaging those collaborations and ensuring we're all on the same page. So if it's Breast Cancer Survival Month, we need to be there. If it's Healthy Hearts Month, we need to be focused on that. If it's women's health, the health department will be collaborating with every entity that's doing something centered around population health. Those conversations are happening, those activities have increased, and that's how we have that conversation more on terms of collaboration.
For the community engagement piece of the community health assessment, the community health improvement plan, we thought it was really important that we actually involve the community not just in the community health improvement plan and the outcome, but that they understand where that information came from, and that the community health assessment was used so much in our community health improvement plan. And so the reason it took us so long, and when I tell people it's taken us, we've been doing this 5 years now, and people kind of cringe at that, but it's really been so dynamic, and it's been such a good 5 years because along the way, we've involved people. And so we know for our community, people don't come to town hall meetings. The mayor has them, he's really engaged with the community, and 2 people come to a meeting. So we knew that wasn't gonna work for us unless it's a hot button issue like tobacco, then half the community comes out. We knew that that really wouldn't work for us to get the level of participation that we needed. So what we do is we kind of use people. In our health department, we touch so many different lives. And so, if it's a restaurant inspection, or if it's a laboratory issue, or if it's somebody coming in the door for immunizations, we interface with so many different types of people just in what we do every day. So what we were working on was using our people to talk to the people we interface with just to get that information out there so they understood. And so I'll go out and talk to civic groups, or our director will go out and talk to groups, or we have a community transformation grant that is, kind of tied in with this, and they'll hand out our health facts, or they'll answer questions about, our community health assessment and the process that we're using. And so for our community health improvement plan, it was actually just released 2 weeks ago. Yeah, so we're still really new into the process. And so my frame of reference is always, I work for city government, and we have a public information officer for the entire city. And so I would go through them and do a traditional press release, and it would get a little bit of press, and that's how we've done everything else. And it, they'll pick it up for a couple days, and things will run like we're really fat, in the paper, and it goes away. And so when we were in a coalition meeting, someone on the coalition, these people have all the political power in our community. They are responsible for every aspect of health and healthcare delivery in our community. And someone raised his hand and said, why not just have a lunch and invite all of the actual CEOs of the media companies to the lunch, get their buy-in, get their commitment, have them commit to running X number of stories or X number of articles or whatever, and go about it that way. And that was, I honestly had never even considered doing that. And it makes all the sense in the world, because then they're doing the work for you and with you, instead of you feeling like you're saying, hey community, we need to be healthier. It's a group effort. And so I think sometimes in public health we kind of get single focused, and we get used to doing it one way. And there's so many more ways to actually not just try to engage the community and stand on the street corner and say, hey, we need to be healthier, but use the people who are your partners and your resources and have them go out. It's that exponential growth thing. It's the same concept.
Those that may be familiar with Photo Voice, where you actually have people take pictures, and in this case we had youth take pictures of their community to describe it. And one of the pictures that was particularly poignant was a youth had a picture that they took, and it showed a series of sticky notes on a wall that sort of descended along the wall, and it's each sticky note had a word, and it said, "Where have all the hoops gone?" and at the bottom of it was a basketball. And so that was an incredibly poignant picture. That picture circulated in the particular community where it was taken, and it has begun to change policy where the basketball hoops were taken down. It started a discussion at the political level, at the council level in the community, and the basketball hoops are back. So it's changed the discussion on a picture from a young kid who really had a very poignant description of something that concerned him in his community, and he's changed the physical activity opportunities in his backyard. That's a great story.